Acetaminophen Tylenol will be the first thing we cover. So let's take this case. 38-year-old man presents with 4-day history. 4 days ago he took 60 Tylenol tablets. Okay? Now he complains of vomiting, right upper quadrant pain. He's got an elevated bilirubin, he's got an elevated PT, he's got an way elevated AST. What do you want to do? Okay. So think of Tylenol poisoning in all cases of jaundice, all psychiatric cases who have right upper quadrant pain, and you'll be in good shape. Do we want to do gastric emptying on this man? The answer is no. This was 4 days ago. These pills have long gone from the stomach. Won't do any good. How about charcoal? Do you want to give charcoal? Well, 4 days is pretty long. If they said 1 day or 2 days, I probably would give a little charcoal. 4 days, all the Tylenol is long since gone from the GI tract. Who wants to give Mucomist, NAC? NAC is most effective if given within the first 24 hours. Certainly it's also correct to give it the second 24 hours, up to 48 hours. After that, the damage is done. Okay? And the only thing left for this poor man, 4 days out, is supportive care. All right? And he might end up actually with a liver transplant if he's damaged his liver enough. All right? Tylenol will also be written as APAP, APAP, paracetamol. The chemical name is N-acetyl P-aminophenol. And I think most commonly you'll see it written in test questions as acetaminophen. Do you remember that Tylenol is metabolized to something called NAPK? And that's the NAPK is the chemical that's the most toxic to the liver. So what we're trying to do is prevent the formation of NAPK with the treatment. Okay? Now, ordinarily, it's the glutathione that binds to the NAPK. Glutathione prevents NAPK from damaging the liver. Okay? But what happens with Tylenol ingestions is you overwhelm the amount of glutathione that the body has. It's all used up. So by giving N-acetylcysteine, that makes more glutathione, which can bind to the NAPK and prevent you from turning yellow, prevent the liver from dying. That's why we're doing it. All right, so, be sure on the liver case to check the PT, because that's what we really want to know if the liver is good or bad. If the PT is normal, there's still some liver function left. How much Tylenol is too much? For someone with a normal liver who's not a drinker, not an alcoholic, 10 grams is toxic. 10 grams is 20 extra strength Tylenol tablets. Okay? Okay? And alcoholics, as little as 8 extra strength Tylenol tablets can cause liver toxicity. All right? Okay. You can get a drug level of your Tylenol, and I would recommend that you do so. We all have seen the diagram where they plot the Tylenol level versus the time of ingestion. That graph is just for acute poisonings. And on that graph, you would draw a Tylenol level 4 hours after the ingestion and then plot it on the graph. And if your level is very high, it's going to recommend that you give the N-acetylcysteine because you're in the hepatotoxic range. I would argue that waiting 4 hours is even too long. You got someone with Tylenol ingestion, you want to give them, you want to consider gastric emptying if it's under 2 hours and it's a massive amount. You want to give the charcoal, and then after the charcoal, you want to give the antidote, the N-acetylcysteine. And then when you get up to 4 hours, then you can draw the level is fine. There's a picture of the graph. Okay? It shows Tylenol level versus hours after ingestion. When in doubt, give N-acetylcysteine. It's safe and effective. On day 1 of Tylenol, the patient feels like they have the flu, may have some nausea or vomiting, some diarrhea. On day 2, they feel pretty good. Maybe they start to have some right upper quadrant pain. And by day 3, their transaminases can be in the thousands and they're turning yellow. Okay? The dose of N-acetylcysteine, it's 140 milligrams per kilogram for the first dose. 70 milligrams per kilograms for the subsequent doses, and the doses are every 4 hours on the follow-up doses. Okay, it is also approved for IV use, which is new. Okay, all right. So to review, here's the sequence of treatment: airway, breathing, circulation. Send someone to find out exactly what else they took. Empty the stomach if it's in the first hour. Give the charcoal. Give the mucomist, right? If the people have a lot of vomiting from the mucomist, you can give them some medication to stop the vomiting. Whatever you like to use is fine. And then if people have complete liver failure, these are the folks that are going to get liver transplants. That's the end of Tylenol. Now you know how to treat it.